What is oxygen deprivation in an ischemic stroke? Imagine a sudden blockage in a major highway that cuts off all traffic to a city. That's similar to what happens in an ischemic stroke, where a blood clot or narrowing artery blocks blood flow to part of the brain. This blockage prevents oxygen-rich blood from reaching the affected brain tissue, leading to a critical shortage of oxygen known as hypoxia. Since the brain relies heavily on a steady supply of oxygen and glucose delivered through blood, this interruption causes immediate energy failure in brain cells. Without oxygen, neurons cannot produce the energy they need to function properly. This energy deficit causes the cells to lose their ability to maintain proper ionic balances, leading to depolarization and the releases of excess glutamate, a chemical that excites neurons. Too much glutamate overactivates receptors on the neurons, allowing calcium to flood into the cells. This calcium overload damages the neurons and triggers a process called excitotoxicity, which can kill brain cells. Oxygen deprivation also hampers the mitochondria, the energy-producing parts of cells, leading to increased production of harmful molecules called reactive oxygen species. These molecules cause oxidative stress, further damaging brain tissue. The area of the brain with the most severe blood flow loss, called the ischemic core, usually suffers irreversible cell death or necrosis. Surrounding this is the penumbra, where cells are less severely affected but still at risk of dying through programmed cell death processes like apoptosis. In addition to direct cell injury, oxygen deprivation initiates inflammation and disrupts the blood-brain barrier, a protective layer that keeps harmful substances out of the brain. Because the brain consumes about 20% of the body's oxygen even at rest and has limited energy reserves, even a brief interruption can cause rapid neuronal dysfunction and death. This cascade of events explains why oxygen deprivation in an ischemic stroke leads to brain damage and neurological deficits. Understanding these processes highlights the importance of quick medical intervention to restore blood flow and oxygen supply. Treatments like clot-busting medications or surgical procedures aim to reopen blocked arteries, minimizing oxygen deprivation and protecting brain tissue. Always consult healthcare professionals for personalized advice and care if you suspect a stroke.